Hello everyone, welcome to Center of Balance Live. I'm Phua from Center of Balance, the acupuncturist. So today our topic is about drugs to treat anxiety disorder. So we cover acupuncture for the best acupuncture point formula for anxiety disorder, and we cover emotional daily practice for anxiety disorder and the best Chinese medicine formula to treat anxiety disorder. Now today we're going to talk about drugs to treat anxiety disorder, right? So right, if you're here on Facebook, please give me a thumbs up. If you're on YouTube as well, please give me a thumbs up and say hi to me, and share this live video as well. Please share this live video. Thank you. The next thing that we're going to do is just checking all my live platforms being on. Seems like one of them is not working. Right, that's all right. If this is not working, I better stop it, I think. Yep, that should be okay. All right, let's start the topic today, so drugs to treat anxiety disorder. So most people feel, about the treatment for anxious. Okay, most people feel anxious at some point in their life, right? Well, I think everyone has this problem. Yeah, and the feeling often goes away by itself, right? So most of the time you don't need any treatment, and you don't need to even take any drugs at all, right? So anxiety disorder is different, right? Anxiety disorder is different. If you've been diagnosed with one, you may need help managing anxiety. So treatment typically consists in the Western medicines. It's about medication and psychotherapy. Psychologists, you need to see a psychologist. But when are you going to see a psychologist? When should you see? Right. So while drugs, I want to let you know that in Western medicine, medication and psychologists, to see a psychologist is the main treatment for anxiety disorder, right? So, but don't. I'm not going to mislead you because if we just focus on medication for anxiety disorder, I need you to understand one thing, that drugs don't cure anxiety. So I'll repeat, drugs don't cure anxiety. So they can help you manage your symptoms so you can function well and feel good in your day-to-day life, right? But it's not going to cure you. So keep in mind that is why when you're on medication, then you're going to have this for the rest of your life. Most people like this, right? So some people manage to decrease it and eventually stop it, and when they need it, they take it, right? They don't take it every day. But I've seen people, some of my patients, they take antidepressant for long time, and they're so afraid to cut it down, right? Okay, many types of medication are available because every person is different. So you and your doctor, so I'm not here to tell you what to take. I'm here to give you information, right? You and your doctor may have tried several medications to find the right one for you. So we're gonna talk about the drugs. So in if it's not a severe one, I normally suggest my patient change the lifestyle, rather than taking medication. And your doctor will say the same too. If a severe one, then you need to see a doctor, maybe get some medication, maybe to see a psychologist to deal with your issues. Okay, there are a lot of methods that can help you, right? Even severe one that we talk about acupuncture, Chinese medicines, and Ho'oponopono method, and those are not to do with Western medication, because one of the things that I don't suggest my patient go to there, and I help my patient to cut down medication, is because you see a lot of side effects from the drugs. So we're going to talk about the side effects of drugs today, and you may not see it. You may not have the side effect from the drugs at the first place, but as you taking it for years and years and years, and the side effect develop. All right. So the first drugs that normally used for this is the we call benzodiazepine. Right. This is the first one. Okay. So benzodiazepine are sedative that can help relax your muscles and calm your mind. So it's a muscle relaxing drugs. Right. I hope you can see it. Well, this is the first one. Right. Can you see it? If you can see it, please let me know that you can see it. Right. This is the first one. Just checking the other platform is going well. Okay, yeah, seems like all can get going well. Right. Now, so they work by increasing the effects of the certain neurotransmitters, okay, which are chemicals that relay message between your brain cell. Right. So these drugs help treat many kinds of anxiety disorder, so including panic disorder, social anxiety disorder. Okay, so there are some drugs called, you may heard about this drug, okay, Ativan, Valium, Clonopin, Librims, Gynex. So those are under benzodiazepines. Okay, those are under this. Okay, very often they use this, but the side effects of this, okay, these drugs may lead to your mind confusion, because put you relax, you can't focus. So most people tell me they're not focusing very well. They can't focus. You're on and you suffer from anxiety, and then you lose your focusing. Then when you're on the drugs, it doesn't help you focusing. So some people I've seen that they're on the drugs, they still can't get back to work. Why is that? Because they haven't got the focus and concentration. They lost the concentration. This drug doesn't help it. And the version problem, they get blurry, or some of them get headaches. And what do they feel? They're feeling of depression. Well, it's very strange that you get a drugs to help you, to calm you down, but you ended up with depression, and that's not good. And in some cases, some patients develop with seizures. So this is very important. If you have taking benzodiazepine regularly for more than 2 weeks, it is important not to stop the pill suddenly, because you need to stop it gradually. And who will be able to tell you and guide you to slowly stop drugs, your doctor. So go back to your doctor. And when I do Chinese herbs and acupuncture for my patient, we gradually stop all the drugs, and I always get my patient back to the doctor, the GP, and ask how to gradually and the right way to cut down the drugs. Because if you cut down this drug very quickly, as it could cause a seizures in some people, so you don't want this happen to you. Okay, so cut down the doses slowly is very important. Do not cut it down straight away. Okay, the next drugs we talk about is buspirine. This one I'm not pronouncing it very well. Okay, buspirine. Okay, and this drug is used to treat, right, both short-term anxiety and chronic, which is long-term anxiety disorder. It's not fully understood how buspirine works, but it's through the affect chemicals in the brain that regulate mood, right? So in general, you need to take up for several weeks become fully effective. You don't expect that you take this one and overnight and you get results. It doesn't work that way. It takes several weeks for it to be effective. So the side effects of this one is you get dizziness. So dizziness, headaches, nausea are the side effects of this drugs. Okay, again, if you want to cut it down, if you see an acupuncturist or taking Chinese medicine or using Ho'oponopono method to help with your condition of anxiety, then you cut this drugs slowly. Who is the best one for you to go? Your doctor, right? Go to a doctor, okay? And antidepressant. The third drug, antidepressant. So antidepressant medication work by affecting neurotransmitters. So this drug can be used to treat anxiety symptoms, but they usually take for 4 to 6 weeks to produce a noticeable effect. Again, it's not when you take it, it doesn't give you effect straight away. It takes several weeks again, right? Now, Zoloft, Proxine, and Lexapro, the common drugs under antidepressant. Okay, I'm pretty sure that a lot of people heard about that, right? So the side effects of these drugs, okay, the common side effects of that are nausea, dry mouth, muscle weakness, diarrhea, dizziness, sinus, sexual dysfunction. So when that side effects came out, nausea, it means stomach and spleen, it harms your stomach and spleen function. And muscle weakness and diarrhea, it harm your stomach and spleen function. Okay, that's according to Chinese medicine. So you may not get this. It takes 4 or 6 weeks to work, right? And then people take it for years, and they start to get dizziness. And I always go through the medication. I say, well, do you know that this medication causes dizziness? And they said that they know that, and they say, I've been taking for years. I say, yes, I understand you've been taking for years, but it doesn't mean that the dizziness does not cause from the drugs. So we work toward to treat the dizziness and work toward to get rid of the drugs. Then eventually this dizziness will disappear, right? So if you get diarrhea, you get stomach problem, you get diarrhea, and you slowly will get stomach pain, or you put on weight, or you get bloating all the time. That can be from the drugs, because the drugs, this antidepressant drugs, will slowly harm your stomach and spleen function according to Chinese medicine, because it has a side effect of diarrhea. Okay, sexual dysfunction is it harming your kidney function, because kidney control the reproductive system, right? Okay, tricyclines. Okay, this another drug called tricyclines. Works as well as antidepressant, do for treating most anxiety disorder. Okay, except for the obsessive compulsive disorder. Okay, it's thought that tricyclines works similar to antidepressant, which is the SSRLs. Okay, like this one, you normally started at low doses and then increase to the increases drugs regularly, right? So the most common drugs, the two that's called norepinephrine and tofurnium, right? Those are two drugs that are under here. So the side effects of this, it can include again dizziness. So when we talk about dizziness, that means that it's not good for your stomach, liver and gallbladder, and also it's not good for your kidney and stomach and spleen, because dizziness always come, according to Chinese medicine, come with this organ, and this organ imbalance. And again, what else? Lack of energy and dry mouth, and they can also include nausea and vomiting. What nausea and vomiting? Over here, stomach and spleen conditions. Constipation means small intestine, stomach and large intestine. Okay, blurry eyes, again liver and weight gains. So by taking those medication for a long time, or you started that you have all the side effects, you need to think about it slowly get your organs out of balance, and it will come more and more symptoms as you taking it. That is why I don't suggest my patient to take medication. I always tell them that acupuncture, Chinese medicine and Ho'oponopono would help them. So try this first, then if you on those medication, cut it down slowly. So I've seen a lot of patients on medication without noticing why they're taking them, and when I ask them to stop them, and they start to get better in the tummy, better in diarrhea, better in constipation, because they didn't even realize that the tummy problem is actually caused from the medication they've been taking for years. Okay, so what are the beta blockers? It's common use for heart condition, but because anxiety, you get palpitation from anxiety, and because anxiety has some physical symptom, that is why when you suffer from anxiety, and the doctor may put you on beta blockers. Okay, so the side effect of beta blockers is fatigue, dizziness, dry mouth and trouble sleeping, nausea and shortness of breath. Right. So again, what does it mean? It means the shortness of breath, lung, trouble falling asleep and nausea, heart and stomach and spleen. Right. And dizziness again, kidney, liver and spleen. It can cause dizziness. Fatigue, which means if the drugs harm any of the organs out of balance, it can cause fatigue. So that's a beta blocker, and that's very common used in heart disease, high blood pressure. Most people have when they have high blood pressure, beta blocker is common use on this for this. Okay, right, stay awesome, and I'll see you next time.